Good morning, everyone. I am so thrilled to welcome Dr. Katie Moise. I hope I'm saying it that right. On the show today, Dr. Moise is a very skilled and compassionate pelvic floor therapist, and she is the founder of ATL Pelvic Health, where she helps a lot of women navigate pelvic floor issues, whether it pertains to women who are pregnant, postpartum, or just along their journey as a woman.
Thank you so much. I'm excited to be here chatting with you today about pelvic floor health. It's something I'm very passionate about. And yes, I basically tell people I spend my days talking about peeing, pooping, and sex. So really trying to normalize these more taboo topics that, have maybe been made to feel uncomfortable sharing with either your partner or your friends, family members, or even maybe your medical provider. So we're really fortunate to spend one-on-one time with our patients for a full hour so we can really get their full story and help address these issues, such as anything related to bladder, bowel, or sexual function that can really, those are activities of daily living. Like those are really important things that we should be doing on a regular basis. And when we have problems, it can either be scary or shameful or different feelings can come up. So really hoping that we can spread more awareness so that people know you're not alone. These symptoms are really common, but they're not normal and you don't have to live with them.
Exactly. And I think the reason I thought this episode was super important is because even for me as a medical professional, I feel like I really didn't understand what pelvic floor therapy did, or even that you guys existed until after I was pregnant. Imagine going through an entire medical education system, right? And learning about all sorts of things, but not knowing that there's this very specific branch of healthcare that is like, I would say essential for a lot of women. And I don't know at some point when women enter that field, I think for, talking to my urogynecologist, it sounds like a lot of women are referred later on in life when essentially more people need to be referred early on. So this episode is super important just because I just feel like not a lot of people understand what it is that you do.
Yeah, I totally agree. I think in the last 10 years, there's been a lot of traction that's been gained with it. But even when I was going through physical therapy school and my medical training, it was a 3-year program. We had 2 lectures on the pelvic floor. I kind of glossed over it, did not think that was the profession I was going to go or the
Mm.
career path I was going to take myself. And it's been really rewarding, but it is so important. And I think just getting that awareness out there is important as well.
Talk about, the aches and pains that women go through that can be related to their pelvic floor that a lot of people are really unaware of.
Yes. So what's really interesting is in physical therapy school, they always teach you to screen the joint above and below wherever somebody's having an issue. So if you're having shoulder pain, we need to rule out the neck, like the cervical spine, and we need to rule out the elbow. But for whatever reason, when we get back down to the lumbar spine or the hip, we kind of forget that the pelvis is also a joint. And
Mm.
so it can be really common to be experiencing hip pain, low back pain, SI joint pain, or pubic bone pain. And it could be kind of like the victim, but the culprit is really coming from the pelvic floor. If you think of the pelvis, it's like this bowl, and the pelvic floor muscles are sitting in the base of the bowl. But on the lateral, outside edges of the bowl are your hip muscles. So they're right next to each other, and you can't really isolate one versus the other in the sense that if your hips are weak, that could be affecting your pelvic floor or vice versa. And so it's really common. I think research shows that 50% of people with low back pain typically have some type of pelvic floor dysfunction. And so I tell a lot of people, if they've been dealing with things like back pain or hip pain for a long period of time, and they've maybe even seen a traditional PT, like an orthopedic PT who may be excellent, but doesn't have the skill set to assess the pelvic floor internally, they could just be missing a piece of the puzzle. And so I think it's not always the pelvic floor's fault, but it is a lot of times there's some underlying pelvic floor stuff going on, whether the muscles are too tight, referring pain to certain areas. And so it's always good to be able to rule that in or out because
Mhm.
kind of anything around the pelvis, like the pubic bone pain, like in the front of your pelvis, or the SI joint pain in the back of your pelvis, can all be impacted by your pelvic floor.
Wow. Describe the pelvic floor for our listeners. Like, why is it important? What does it do? How does it support pregnancy?
Okay, great question. I should have brought my model up here.
Oh, you
Even
needed
though
your
this is a
little
podcast.
model.
Yeah, I have it downstairs. I should have brought it up. But so our pelvic floor is a group of muscles that I like to think of them as like a sling or a hammock. So if our pelvis is this bowl, they're running from the front of the bowl at your pubic bone and then wrapping all the way behind you to your tailbone. And so it's this sling of muscles. There's three different layers, but all together, those muscles are going to work to support your bladder. So they're keeping urine inside of your body until it's time to empty your bladder. Same with stool or gas. So
Mm.
until it's time to have a bowel movement. And then those muscles are also important to be able to relax, to allow a bowel movement to come out without straining or extra like bearing down to get it out. Several of the muscles on the first layer, which is like the most superficial layer, are attaching directly to your clitoris. So they're going to play a huge role in sexual arousal, pleasure, ability to tolerate any type of penetration into the vaginal canal for females. They're supporting your internal organs. So in a female, your bladder, uterus, and rectum are all resting essentially on this bowl of muscles. And so there's ligaments and connective tissue and other things. But if we were to remove the pelvic floor, like your everything would just kind of be like dropping out of the pelvis, which would not be good.
Mm.
So they're doing all of that support. And then they're also providing stability to our body. So there's a group of muscles, including your pelvic floor, your diaphragm that's like at the top of your, underneath your rib cage, your pelvic floor is at the bottom of your pelvis. And then you've got your muscle called your transverse abdominis that wraps around you like a corset, and then some small muscles in your spine called your multifidi, but they form basically like a canister. And these muscles are going to anticipate movement and then provide stability for whatever that movement might be. So we know from research, they're turning on and working for us, whether we are picking up a piece of paper off the floor or we're picking up like our kid off the floor.
Wow.
And
Wow.
so we need those muscles to turn on and be working together the right way to give us stability so we don't like hurt our back while we pick up, our kid off the floor. And they also, I mean, our brain is really smart. It's able to determine, okay, we need less effort to pick up a piece of paper off the floor than we knew the kid, but both activities, we need a little bit of effort. And so how much
Mm.
and so during pregnancy, a couple of things are going on. So, one, your body is changing rapidly over those essentially 10 months. Your pelvic floor is going to kind of start to lengthen and get a little bit weaker just from the support of the baby growing. Your uterus weighs more than it ever has before. And so, we're going to start seeing changes to your pelvic floor. I always tell my pregnant people too, like your pelvic floor will almost start to feel tired because it's working so hard to
Mm.
help support everything in your body. And then also during pregnancy, we're seeing a lot of postural changes. So women will talk about how they like maybe waddle when they walk towards the end of their third trimester, or when they stand. There's just different changes in our posture. Our belly is stretching forward. And so our center of mass is changing. And so that's just going to impact other muscles around our pelvis. It's going to impact your abdominal muscles, your hamstrings, your glutes, and
Wow.
all of those muscles help to support the pelvic floor. So if they're getting weaker and your pelvic floor is getting weaker, that's when we might start to have symptoms or issues. And so during pregnancy, it's really important to like make sure we're keeping an eye on keeping everything strong and active so that it can support your baby. But then at the same time, it's this balance of we want it to be strong to support the growing baby. And also, we need to know how to relax those muscles if we're hoping for a vaginal birth.
Oh my goodness.
So it's kind of twofold there. In the third trimester, for a lot of people, we work on how to relax your pelvic floor so that you're able to effectively push vaginally and get your baby out.
Wow. So you need your pelvic floor to support a human, right? This big old
Yes.
human that's sitting in like literally in your hips. And then you need your pelvic floor for childbirth. Can you talk a little bit about that and, just pushing and what that impact of just the movement can do to your pelvic floor in that process of birthing a child?
Yes. So with birth, I always tell people there's a common misconception. So with birth, your pelvic floor isn't actually pushing your baby out. What is going
Mm.
to get your baby out is primarily the uterus contracting and then also your abdominal muscles kind of helping to push. But the pelvic floor does need to be able to stretch and open up to basically get out of the way. And knowing how to do that, especially for somebody like me who maybe like holds a little bit more tension in our pelvic floors, to then know how to like stretch it and get out of the way is a skill that just like you wouldn't just go run a marathon. I mean, maybe you would without training, but it would not be recommended. Similarly, that's why we would love to see patients during pregnancy so we can work on that skill rather than learning it in labor itself.
Mm,
Because once you're in active labor, there's a lot going on, adrenaline is pumping. And then if you're trying to like figure out like, okay, how do I breathe and push this baby out and get my pelvic floor to get out of the way all at the same time, that can be really, really hard. And so what can happen is that can lead to longer pushing times. And we know when there's more, the longer you push, especially if it's over 2 hours, that's going to lead to an increased risk for prolapse. And prolapse is essentially just the lack of support of your organs. So women will complain of like a sensation of something falling out, or like a heaviness or a pressure in their pelvis or things like that. So we want to do what we can to try to avoid that excessive pressure during pushing, especially keeping pushing under 2 hours if possible. There's potential for increased perineal trauma. So you can have tearing of the pelvic floor muscles. And that, again, there's different levels of tears, but depending on the level of tear, that's going to determine like which muscles of your pelvic floor are impacted, which may impact your bladder function. It also may start to impact your bowel function as well. So difficulty keeping stool in and things like that, difficulty holding back gas. And so, and I mean, there's lots of other different, birth is kind of a wild experience. And so there's a lot of different things that can go well, and there's things that can not go as well. But in general, we want to try to protect the pelvic floor from having all of that excess pressure from like a lot of like straining and bearing down, which is going to, the pelvic floor is already vulnerable because it's stretching so much to birth your baby. And so then extra pressure on top of that can then lead to those symptoms, like I mentioned, like prolapse. I mean, you can have a tailbone injury during birth, so many different things. And the pelvic floor muscles are attaching to those parts of your body, which can then be impacted.
wow, powerful. So let's say I have a lot of listeners on the show. Some are pregnant and are about to undergo, they're about to give birth. But I also have, most of our listeners are postpartum. And so they may not have been privy to get in front of a pelvic floor therapist or listen to this episode before actually giving birth. So let's say you are postpartum and you are listening to this. If they want to sort of do a deep dive into their body and all the feels, let's talk about what is normal postpartum and what is abnormal, right?
Okay.
What are some red flag symptoms that you can tell our audience, like you need to get in with a pelvic floor therapist ASAP to evaluate you?
Yeah. So I'll kind of go through like from bladder, bowel, and sexual function and talk a little bit
Mhm.
about each one. I would say the most common with bladder that we're going to see is leakage of urine. And that is one it's interesting. So if you have an epidural with your birth, one of two things can happen. You can either like have a really hard time keeping control of your bladder once the catheter has been removed, or you may actually have what's called urinary retention, where you have a hard time getting pee out after you have
Mhm.
that catheter removed. That I think we see people who have urinary retention and we can help them kind of regain bladder control. I think most people are kind of stressed when that's happening because they do have to have a catheter to void. So
Mm.
usually they're getting in front of the appropriate medical professionals pretty quickly. I will say with the leakage of urine, like the first 2 weeks, if you're leaking a little bit of urine, your pelvic floor has just gone through a lot. I wouldn't be really concerned about it. However, if that's persisting past the first couple of weeks and you're noticing you leak when you sneeze or cough or bend over to pick something up, or when you go for a walk, or I've even had patients where it's just kind of like involuntary, like they're just leaking urine all the time, like nothing's even really
Mm.
triggering it. That would be a reason I would definitely get assessed by a pelvic floor physical therapist. I think leaking has also been really normalized in our culture as just like, yeah, you had a kid.
Unfortunately.
Like, like we just write that off. Like you've had 3 kids, you're never going to be able to jump on a trampoline again without peeing your pants. Or you live your life with like a panty liner forever because you're always worried about that, which is not
Wow.
something we should be doing. So that's a big one that we can make a positive impact on. And I think the sooner you can get in, the better. As far as bowel movements go, I would say constipation is a huge one. And what is going to go with constipation can be either hemorrhoids or anal fissures. Both of those would signs that you would maybe have some of that is if you're having any bleeding with wiping or in your stool, or if they're just like really, really painful to have a bowel movement. You would definitely want to follow up with your doctor about that. But then there's a lot that we can do from a pelvic floor perspective to kind of help with the healing of an anal fissure or a hemorrhoid, but also to just get your bowels back on track. The loss of blood volume during birth, potentially pain medications during birth, if you went under anesthesia during your birth, anything like that is going to impact your gut motility and your bowel function.
Mhm.
And a lot of women are scared of bowel movements. Like they're more scared about having their first poop than they are like actually birthing their child. And so there's a ton of things that we can do to kind of support your pelvic floor and your gut function to make that easier. On the flip side of that, if you're noticing like you can't hold back gas, or you are noticing like even like smearing in your underwear, which would kind of fall under the category of fecal incontinence, or you're like wiping a ton, like you just feel like you have a bowel movement and then you're wiping. All of those are also signs that are not normal that you should
Mm.
seek help. And then as far as sexual function goes, and again, this, I always caveat this of like, you can get cleared at your 6 week. I even had a patient the other day that got cleared at 3 weeks.
Oh my goodness.
Yeah. She went 3 weeks and her doctor was like, okay, you can have sex, you can run, you can do all the things. And I was like, okay,
Wow.
no, like let's
No.
back it up a little bit. But even when you're cleared at 6 weeks, there's a lot that goes into sexual function more than just your tissue being healed. And so that is not like a end all be all, like you need to be sexually active with your partner at the 6 week mark. However, whenever you are sexually active, if you experience any kind of discomfort or pain with intercourse, that is a sign that you should get help with pelvic floor therapy. Research shows
Mm.
that 3 months postpartum, if you're having pain with intercourse and there's no intervention done to help with that pain, at 6, 9, and 12 months postpartum, you're most likely going to still be experiencing that pain. So it's one of those things that I think some people are just like, oh, it was the first time, like things will get looser, that'll get better. But we really know from research that that's not true. And so just kind of grinning and bearing it, or like, some of the advice that you hear about, like, just drink a glass of wine and relax, like, that's not necessarily going to be the answer. And sexual health is really important and it shouldn't have to be painful. So there's so much we can do, even from like a tissue quality perspective. If you're a mom who's producing breast milk, there's going to be impacts to your tissue quality that we can educate you on that may be contributing to part of your pain. Looking at scar tissue, either from a cesarean birth or from any tearing during a vaginal birth, and then assessing the tension in the muscles themselves. So looking at all of that is going to be really important. So just knowing, okay, pain with sex is not normal. And then the last kind of big thing I think I would keep an eye out on if you're postpartum is any of that like heaviness, pressure in your pelvis. Like if you feel like something
Mm.
is falling out of your vagina, if you're feeling heaviness or pressure, that would be another sign to see a pelvic floor therapist. And I will also say a lot of these symptoms for people, it's common for them to not show up right away postpartum. So
Mm.
a lot of times people will actually feel pretty good right after having their baby, but we're also like needing our body to rest and heal so we're not as active, which is important. But then as we start to increase activity level, maybe 6, 12 weeks postpartum, or even like 6 months postpartum, once you're like sleeping maybe a little bit more and you start to get back into a rhythm and a routine, that can sometimes be when these symptoms start to pop up. So we kind of want to be mindful of it really, I mean, really forever. They say postpartum's forever, but especially that first year postpartum.
That's good to know because I think, and the further along you get postpartum, I feel like women are stop attributing things to their actual birthing process because now you're down, let's say you're 6 months down the line and your hip is hurting you or you're struggling with leakage or constipation. You're not thinking, oh, yeah, that baby that I birthed 9 months ago is what's causing this. And so you just end up going through life and maybe putting a Band-Aid on something, taking some Tylenol, a Motrin for that discomfort, being getting comfortable with the fact that you're having pain with intercourse and ending up just getting to a place where you're silently suffering and don't know that every action is making your symptoms worse and could potentially be worsening the pelvic floor. So super important discussion that I think we're having here today. I do want to ask you about the impact on physical activity. You have all this news right now. I think Cardi B is out here working out and every and some doctors are like, "Oh my gosh, she literally just had a baby 1 week ago." But there's this like snap back culture that we have that women need to get back to working out and losing weight. Let's break down physical activity and the potential impact it has on our pelvic floor.
Yes. Okay. So this is definitely a hot topic because, like you said, we see, and they're, celebrities, they have a lot of resources at their hand. We've seen even like Olympic athletes who have been competing at a very high level very quickly postpartum. But when we really break it down, what we know about the body is that up until 12 weeks, so you will typically get cleared in the 6-ish week range by your doctor for everything. But what we really know is that your pelvic floor is not ready to take on the load of more like plyometric type movements until closer to 12 weeks. So, like the running, the jumping, the burpees, jumping jacks, that kind of stuff, we really don't want to introduce until 12 weeks. With that, though, we also really want to make sure that we're building a foundation for those first 12 weeks. So it's really common. What we see a lot is that moms do nothing for 6 weeks because they're told don't
Mm.
do anything for 6 weeks. So we know your body's getting weaker because you're just less active, you're sitting around more. And then at the 6 week mark, you get cleared. And then all of a sudden, we're like gung ho doing everything that we were doing pre pregnancy. And we really need to find this middle ground. So we always work with patients like there are things that you can do day one postpartum, day two postpartum, as it pertains to just like breathing, starting to kind
Mm.
of wake up your pelvic floor muscles in a gentle way with your breath. So there's a lot of power in diaphragmatic breathing. And then there are certain movements that we can do in those first couple of weeks that are like low level, like glute bridges or different core exercises. And then we can start to build on that. But I think building that foundation, just like a house, is so important so that your body can then tolerate these higher level exercises. So, like, and if you think about being a new mom, it's like you're squatting all day long, you're picking up car seat, strollers, your baby, like all of these things. So we want to make sure that you're doing that in a way that is supportive of your pelvic floor. And so, I like really try to empower my women that I see in my office. Like, we're going to get you on an exercise program that fits your lifestyle and like works towards the goals that you want to get to. However, we're not going to be running 3 weeks postpartum. There's got to be this balance. And I mean, I took a continuing education course with somebody, and I think there's a lot of I really appreciated her sharing her story. I think women, we also underestimate just like the mental health aspect of postpartum. And so her identity was in CrossFit, and that's like who she was. That's
Mm.
like her identity was there. And so she had a really challenging birth, and she just kind of felt like she was losing herself. And so she went back to CrossFit a week or two postpartum, and she was a
Wow.
pelvic floor therapist. She was like, I thought I would know how to modify exercises. And these would be her words, not mine, kind of like destroyed her pelvic floor
Oh my God.
with like developing a really bad prolapse and like all of these things because she tried to jump into it too soon. And she's doing well now. Like she went through, but it was a long road of recovery and probably a longer road because she jumped into those exercises too soon. And I will say, like, my patients who I have seen for multiple births, so like I've seen patients who come back like after baby number two and then baby number three. And each time they almost learn to like take it even slower to build back up, but they come back ultimately stronger. So
Mm.
it's this mindset shift of like, okay, if we can lay down these really strong foundational things early on, in the long run, it's going to set you up for success. But that's hard to kind of flip that switch when we are feeling all of these outside pressures of like bouncing back, fitting back
Mm.
into our clothes, looking a certain way, all of these things. But if we can kind of take a step back from that and know that like we are setting up our body for a success to be strong, to not have pressure in our pelvis when we lift a stroller into the car, we can chase our kids around the block once they're walking and running, or go to a trampoline park with them and not pee our pants. Like that's ultimately what we're trying to get you to be able to do.
Mm. I love that. And Katie, just for our audience, you are also a mom. So you're not
Yes.
only just preaching this, you actually have lived it. You have lived experience. If you can share some exercises or techniques that really helped you when you were pregnant, when you were delivering and postpartum, maintain good pelvic health function, what advice would you give our listeners?
Yes. So I would say two things. One, I did struggle with a lot of pubic bone pain during my pregnancy. So I felt like that was very relatable now to a lot of my patients who come in with pubic bone pain because I've been there and it stinks. And so
Mm,
I learned a lot of strategies on how to manage that. Pubic bone pain can be a lot of different reasons. I think for me, it's a lot of tension, but also weakness in my inner thigh muscles. So, different exercises that I was able to do to kind of like help strengthen that area of my body, like a ball squeeze with a bridge lift or things like that. But then also somebody who tends to have more tension in her pelvic floor in my third trimester, I focused a lot on like yoga like positions. So sometimes
mm.
yoga with like the wide leg stances can be like, could increase my pubic bone pain. So I had to be mindful of that. But like cat cow and child's pose and some thread the needle to work on some spinal mobility and things like that were really helpful for me to kind of help relax my pelvic floor. And I think that helped set me up along with also seeing someone in my office for pelvic floor therapy so they could do some of the internal work, but that really helped set me up for success during my pregnancy and for my birth. And then postpartum, I there are lots of different online programs that you can follow. I followed something called the Bloom method and they just had like quick 15-minute videos that I because sometimes it's like I have the knowledge and then I also like to be told what to do and not have to like think about it for myself, especially in those early postpartum days. But I really focused on like my breath work, reactivating like my deep core muscles. And for somebody who was doing Pilates pretty much up until my due date, it's very humbling once you no longer have that space occupying baby in your body to be like, this feels really hard. But I tried to go really, really slow with that stuff and kind of build my foundation from there. So, like, again, just like gentle activation of my deep core, my deep breathing, some pelvic floor, gentle activation exercises. And then from there, I was able to build on like body weight squats and body weight lunges, and then continue to progress from there into running eventually.
Wow. And how old is your is it your daughter?
Yep, I have a daughter. She is 18 months.
Wow. And so
Yeah.
even still now you're still employing all of those techniques that you learned, really those exercises that you've gotten off the app. Do you still find yourself doing all of those and taking it slow?
Now I would say for the most part, I've returned back to like my normal exercise routine.
Hmm.
There are some things that I'm like, that still feels different. So for me, like in Pilates, if I'm doing any inversions or like my legs are like really high over my body, I'll kind of like feel a sensation in my pelvic floor, which will just remind me like, okay, I need to get back on track with some of my pelvic floor exercises to make sure I'm not like holding my breath or bearing down, doing these like more advanced core exercises. But I would say it took me a while to get there. 18 months postpartum, for a lot of people, they would be like, oh my gosh, like ready to have another baby,
Facts.
but it's like I felt like I needed to take a little bit of a slower, just like I knew for myself, like I am somebody that's like, let's get back into it. Let's just jump right back in. But I knew from my educational perspective that like I needed to take it slow and build those building blocks so I could do the more advanced exercises that I wanted to do.
As we are coming to a close, how can our listeners find a pelvic floor therapist? Who needs one? When do they see one? Where do they go? How do they even go about having this conversation? Because let's be frank, they're probably not going to be sent there unless they have problems. But, right, moving
Yeah.
away from reactive medicine, this is why I'm doing this podcast because we shouldn't be reactive all the time. We need to be preventative. We need to make sure that we're not getting to the point where women are needing to be thrown to pelvic floor therapy because stuff is wrong. So when should women really seek a pelvic floor therapist?
Yes. So I'm biased. I think almost like primary care medicine, like we should be like having a yearly checkup of our pelvic floor to have a baseline function of like how things are going. But I would say like if you are preconception or early pregnancy, that's always a great time to start. We love to see people that are like not having any symptoms at all, but are just proactive, like you mentioned, like early second trimester, like out of the first trimester. Let's just kind of see your baseline. And then let's get a
Mhm.
plan in place to kind of help support you through these changes over the next 6 months. So I think that's really great if you are in that preconception or early pregnancy phase. If you're postpartum, now is the time to start. It's never too late. We see people who are like in their 60s and 70s that are having symptoms that we could probably trace back to their pregnancies and births, but it's never too late to start. I also think the earlier the better. So there's a lot happening in those early days. You're not sleeping, you're adjusting to life with a baby. But when we can see patients like 4 weeks postpartum, even as early as 2 weeks, but like I think 4 weeks is kind of a sweet spot of just mentally being able to like take on information, we see them progress and heal really, really well. So if you can get in early after having a baby, and if you're kind of in that phase of like you're about to give birth, you feel like it might be too late to get a pelvic PT now, going ahead and trying to find one so that you can have it ready to go postpartum. Because again, it can be overwhelming to be doing all of that research with a fresh newborn at home. So if you're
Mhm.
in the, I mean, we see people as late as 38, 39 weeks for their first visit who are kind of last minute trying to scramble and get into us. But you could also just go ahead and start doing your research now before your baby arrives so that you're set up for success in those postpartum days.
Lovely. I love that.
Um,
And
to find a
yes, that's what's
to find a pelvic PT, there's a lot of different resources online. There is pelvic rehab. I think it's pelvicrehabfinder.com
hmm
or just pelvicrehab.com. You can search your location, zip code, etc., and they can generate a list of different providers. There's also through Pelvic Sanity, they have a practitioner guide or like a map where you can also do a similar search. So those are two places to start. I guess the third, Herman and Wallace, that might be the one that's pelvic rehab. The Herman and Wallace program also has a practitioner lookup where typically you can put in your zip code and it will spit out the closest practitioners to you.
Great. And how do they find you?
Yes. So to find us, we are located on Instagram at ATL Pelvic Health. That's also our website, atlpelvichealth.com. If you have any questions, there's a contact page on there. So feel free, you can submit your information there and I can reach back out to you, answer those questions that you might have. And then you can follow us along on Instagram for any good pelvic health content and things that we are doing at the clinic.
Lovely. So we definitely covered a lot, and I'm sure there's tons of things that we could just elaborate and go in and talk about. But I just want to summarize it here. As you are looking into getting pregnant, you should be thinking about your pelvic floor. You should be thinking about consulting with a pelvic floor therapy. Once you are pregnant, try to really get with a pelvic floor therapist to know basically just to get a baseline to know how to go into having a proper vaginal delivery where you're not causing too much damage, get help with pushing, and then going postpartum, where you definitely probably should get a pelvic floor therapy even before you get those conditions that we talked about, the leaking, the sexual dysfunction, whether it's pain or difficulty with intercourse, the constipation, the bowel leakage, the ab separation, all of those things should signify, hey, I need help and I need to get a pelvic floor therapist. But let's be proactive. Let's not be reactive. Thank you so much. It's been lovely having you on the show, and I'm looking forward to having you back for other topics.
Awesome. Thank you so much. I
All
appreciate it.
right. Take
Bye.
care. Thank you for joining us on this episode of Fourth Trimester Voices. If you have any questions about today's episode or you want to share your story, please email us at fourthtrimestervoices@gmail.com. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.